Thank you very much, and thank you for inviting me. And I really do think it's great to have speakers come in to try and bridge the past to the future. And my hope today is that you'll have some new perspectives on work family and work life. And this is an area that we all think we're experts in, because we are. But there's also data that can help us maybe move policy at the societal level or in our organizations as well. So I wanted, before I get to a personal story, tell you the 5 key themes we're going to cover in the talk today. The first is on transforming work-family life relationships. So just like strategic human resource management trends, we need to really look at the demographic trends that are really driving this. And as you're looking at labor market issues, even here in the UK, this maybe could provide data to think about how we encourage people to stay and want to work in our countries. And then we have societal ambivalence about work and life. There are different competing theories. And we'll talk then about interventions and can we change work and not just workers. So the earlier panel today talked about how occupational psychologists often focus at the individual level. And we do need to focus at the individual level, but we also need to think about how to change organizational contexts as well. The decisions that we see as individual decisions are constrained by the opportunities that we see in our environments. Can't not talk about work and family without talking about technology. And lastly, flexibility and access to it as a new form of job inequality. Work-life inequality is really a growing problem in our society. So this was me many years ago, and I wanted to tell a brief story. And I would like you to think about your own story as you developed a passion for why you study what you do, why you work where you are. And I was a doctoral candidate in organizational behavior at Yale University. And there's my husband. He's actually here tonight, so you can say hello to him. And basically, I was going to have a child while I was getting my doctoral degree. And what's the best time to have a child when you're an academic? September. and so and at that time, there were very few married students in the doctoral programs. And I don't know if they had given leaves before. And I wasn't sure, right? So I went and talked to my professors, and they're very famous people. And they were very nice, but they said, oh, when you're Yale Fellowship, you'll have to apply again after the baby. And I'm like, we weren't very wealthy, and it was just another thing to think about. So I decided, all right, we'll get support. And I won't take a leave because it was too uncertain. And it ended up working out okay, but I just think we haven't gone as far as we could today. If you look at policies even here in your organizations and how we manage these. And I'm happy to say that Rosabeth Moss Cantor was on my committee. At that time, she's very famous for study of work and family. A famous sociologist, wrote Men and Women of the Corporation. And basically, at that time, she'd moved on to innovation, but was on my committee and kind of inspired me to think about human resource policies. And I've sort of continued this work my whole life. So let's talk about theme 1, some of the transforming societal trends, increasing work-life tensions. I am trained also in human resource management, having an MBA from the University of Michigan. And I do think as occupational health psychologists, we need to sort of bridge some of these demographic trends to sort of make the case for why organizations need to respond to some of these really serious trends affecting the economy. So if you wanted to look at the different trends, and many of these you've heard before, but just briefly, if you add them all up, we are hitting a tsunami, and we need to really make some societal and organizational change in how work is structured. So family structures have changed, particularly in all countries, but especially in Western industrialized countries and across in Asia, where dual earner families are the modal model, where it's nearly of those who work, many of them are juggling another career. And we have this rise also at the same time in non-traditional families where many people are partnering but not necessarily getting married. And what's resulting, or the result of this, is that half of all children will live in a single parent household for part of their lifetime. In addition, we have at the same time the aging workforce and the aging of our parents. And we have done so little on economic policy to deal with elder care. We're having trouble enough with child care, but we need to act on both immediately. We also have the feminization of educational institutions and business, where in the States, over half of all the educational degrees are given to women, but then something happens about 6 to 8 years in where there's sort of a ceiling and people are still not rising. We also have greater diversity and globalization in terms of the hours we work, growth in immigrant families. So if somebody needs off to go see grandma or their parents, it might be flying to India. And 3 days off from work over the Christmas holidays isn't going to do it. We also have population declines in replacement workers, and we're moving to really have underfunding of our social responsibility supports for pensions, health care, welfare state. We are at crisis moments. And at the same time, there's economic discontinuities in how work is structured. We've moved to the gig economy, the Uber-like economy, and we are really like social programs for teachers and people retiring in the States are moving to 401ks, and there's dramatic labor relations crises going on as well. So there's no reason to wonder why we are experiencing societal work-life tensions, and these economic issues need to be front and center. So I thought I would pull some data to make the business case of why this is so important. And you can see from OECD data that we are dramatically decreasing fertility rates across countries. And to have a population that replaces itself, or which is important for our economy to grow, we need fertility rates of 2.1 per couple. And the only two countries that have that rate right now are Mexico and Turkey. So you're either having immigrants come in or you're encouraging people to have children. And without that, your economy is going to lag in terms of workers for the future. What does this look like for pensions? Well, this is Brazil, okay? Brazil is how we used to look in England and the US, where you have lots of younger workers at the bottom, like a pyramid. And then as you go on up and are aging up to 60 and beyond, people are able to retire. So we have this as a wonderful picture. But now, look at Germany. We have much fewer younger workers, and then we have this kind of boa constrictor blockage as people are aging, and we are not going to have, we have a convex pyramid, we are not going to be able to support retirement, and this is mirrored in many Western countries. This is a problem. Let's take Japan. Japan, I actually worked in. So one approach I had to this is I actually did work for companies like IBM and Personal Research, Hitachi, and a Japan Society Fellowship, and I actually served on their board for management education, was flying back and forth. I worked in Europe in Geneva, Switzerland for GTE, which is part of Verizon. And at the time, Japan was still one of the few countries where really women retired about at age 28 when they had a child. But now if you look at the green line there, that's the elderly population, and that's 2050. And you then see the working age population, and there's not enough people working to support the aging. This is happening all over the world as we develop. And now you look at the labor supply projection of females entering and staying in the Japanese workforce. And it's not going to be till 2030 where they hope that women and men will be at equal rates. The dotted line is female. And if you though look at the combined rate at the bottom, that's still a declining number of labor entrants. So you have to deal with diversity and gender at the same time to be able to have a healthy economy. It's kind of frightening. So on to lighter notes in terms of trends. Obviously, we have to talk about social media and technology as another transformation, as Monique talked about at the earlier workshop about managing our energy and email all the time. And we also have to be careful because we really have fewer boundaries in what we're doing in our personal life and in business life. So I don't know if you heard about this Yale dean that a week or so ago lost her job. She posted on Yelp some reviews of restaurants, and she used some terms that referred to class and also other parts. She was Asian, but commenting on whether people would know good food, and it was basically, and she also made fun of the university town where she was working. She said there is no view. She was from California. And the students' newspaper found 10 of her posts that were kind of offensive, and within a month or so, she was fired. So free speech means the government can't punish you for being a jerk, but your boss and employer certainly still can. So that's sort of another work-life relationship that's really transformed. Another one is Facebook, and I'm friends with a few people here in the audience from the UK. I kind of feel like I know what's happening, but I sort of resist posting sometimes, except for a professional, and even then I don't like that because it seems like it's bragging. Well, think about if your boss, have any of you had your boss or friend you on Facebook? Well, it's OMG, my boss just friended me. What do you do? Should you accept or not? And what the research shows is you probably should, except people first go, ooh, this is like my parents friending me. Do I really want my parents to see everything that I posted? And then reciprocity and sharing of personal data is another thing that could help your career. So just another example, we've got the demographic trends, and then we've got technology really shifting everything. Lastly, before we move on to the next trend, I wanted to also make the point that work schedules are really a work-life issue that we have not paid nearly enough attention to. Here at this university, many courses at night, but I'll bet many professors start working at 8 or 9 in the morning, and then you're teaching till 10 or 11 at night. Those are really long days. So I've been doing some work in 24/7 organizations, and this is a scheduler for a nursing home. And I just published a paper in the Industrial and Labor Relations Review. It's on a worker that I don't think we've really studied very much, but it's really important for well-being of so many workers. The work scheduler, the person who makes up the schedule. And basically they're serving a new organizational role between management and labor. And if the scheduler likes you, you are able to get the schedule you need to be able to care for your children, go to school. But if not, you will get written up and you could get fired. So we found in 4 types in different nursing homes. And let me let you vote. How many people think that the scheduler that served employee interests were the best type of schedulers? You know, helped employees with their work life. Was that best for workers? Okay. In the organization. How about the people who looked at the employer interests and looked at labor costs and economics? Okay, same number of people. How about people that really looked at the needs of patients and put the patient first? Right, because we had those trade-offs, the customers. Well, the person that was, the type that was the best was what I call balancers. And it's very hard. You have to juggle these competing stakeholder interests. Now, what's difficult is we don't train work schedulers on human resources and labor relations. The people who just supported the employees and said, oh, you can miss tomorrow. Well, now we're short-staffed, so we're not, you know, and so now somebody has to work a double shift or cover a lot of work, right? So they're not happy. And then the people, just like the employer interests, well, that's basically looking at cutting labor costs often. And then the customer really is important, but like students, we have to make sure that we just have to make sure that they are first, but we also have to make sure that we're spreading the labor around and making sure that everybody gets some good care. And the by the book people were the worst. They were the people that just read the policy and said, 3 absences, you're out, for example. And we really need people to do more job crafting and creativity to manage these competing demands, but we don't help our people think of this way. And in fact, scheduling is written up as a very boring kind of topic about how you allocate labor. And yet there's really a lot of creativity and management thinking that's needed to make our organizations adapt to societal needs. All right, so I hope I've convinced you that there are some trends from demographic shifts and the changing nature of families, technology shifts, and even the idea that work is happening in more and more organizations 24/7, not just in nursing homes, obviously, but with global work. Many of us might have to take a call at 2 in the morning if we have a colleague overseas. Let's now think about how we think about these trends and the competing rhetorics. And I would argue that we're pretty ambivalent and we have not acted very much as a society. So particularly especially in the US, but I think in many countries, family and personal life are not viewed as contributing back to what the individuals provide to work. And many workplaces don't see family and personal life as supporting economic competitiveness. And also we have this problem that societal resources and rhetorics are shifting as to how we support work and personal life. So in a paper I wrote with Ariane Ollier-Malater, who is French and now lives in Montreal, we also thought about the different rhetorics that societies use and organizations to justify allocating resources to work and life. One of them is health. We're going to make people healthy. All right, so if we did that, we'd really need to measure stress, health, preventative health, exercise, but do we do that? Not so often. We just say employees aren't exercising enough, right? So employers need to make this front and center in terms of how they value people's personal lives and see it as benefiting the company. If we look at productivity, we'd look at turnover, we'd look at attraction, we look at promotion rates of people with different caregiving demographies, but we don't really look at that very well. We just sort of measure turnover rates. And we need to look at how can we change organizations to attract people of a diversity of family background, from those caring to elders to sandwich caregivers to people with young children, to people who never marry, but just want to have a happy life and a long career. In terms of gender, many countries see work-life policies as promoting gender equality, yet as we'll see in some other stories I will share later on, there are unintended consequences of policies where if women end up using them more than men, then they don't advance. So they get out of the labor force, or they have a slower growth in their pay, and people never catch up in terms of pensions or careers. So the answer would be gender equality and promoting longer leaves and use of flexibility if both partners or men and women take them. But the implementation, even in countries like Sweden, is still a challenge, and they're one of the leading countries. And then lastly, poverty inclusion could really be improved through greater and more effective use of flexibility. And we have not really figured out how to help a low-income retail worker, for example, be able to work enough to pay for a family and then still go to school and care for kids and have a long commute. And so I've been doing work really at all levels of the labor force, but most recently a lot of my work has been with grocery store workers and also nursing home assistants, and it's quite challenging. The ideal I would like to see for policy, and I would like to see more occupational health psychologists involved in policy and not just give this to the economists, but work together, is that employers should supplement or complement state policies. And then we think about government policy providing a floor of basic rights for work life, and then monitor discrimination against policy, access, and use. I wanted to give you some work-life basic terms now. There's a lot of phrases out there. So when we think about stress, and we have job stress and family stress, it impacts not just the worker, but it impacts partners and children and co-workers. So one term that's often used in the research is spillover, and that's when the effects first of the workplace are felt by the worker when not working. So you have a bad day at work and you come home and you just kind of sit in front of the TV, you have a beer and you don't talk to anybody. All right, and maybe you tell your kids, go watch TV, I'm too tired. And maybe you go order a pizza because you say, I'm not going to cook. All right, so now you're eating less healthy and maybe your family is. Crossover is when the effects of the workplace on the worker are felt by others. So maybe we've all worked for maybe a boss or a coworker who's stressed, and then somehow we're more stressed at work. Or if our partner has stress, their job stress carries over to us. So that's called crossover. But it's not all bad news. Enrichment is another process for work and family, and that's when positive knowledge, skills, or emotions are transferred between work and non-work roles. And we need to emphasize enrichment a lot more. So having a job is good often for our well-being. It's nice to have a paycheck. It's nice to get recognition at work. It's great to be able to go to school part-time while getting a job. It's great to learn how to use computer skills and then be able to take that at home. And so that's a newer part of the research that I think has been underemphasized in a lot of our studies. And lastly, we need to then look at how this affects our own health when these processes, if we do have more enrichment, and also the health of our families and children. So occupational health findings have done a lot of work saying that, this is important to look at how work affects well-being. What I would like to see us move from is not only descriptive studies of saying what's wrong with work and how we have work-family conflict that is greater in certain types of job situations, but try and be proactive and design the work to prevent work-family conflict or work-life conflict occurring in the structure of work. So what would that look like? That people would say, I'm going to make sure that you can use an hour every day for personal needs or exercise or over a week. And right now, it's really not, unless you self-manage it, it's probably not going to happen. That what do organizations reward? They reward people who work long hours. And professionals in particular get sucked into this because our identities are often linked to our jobs. And it's much more immediate feedback, that pay or promotion, than whether your kid 30 years from now turns out to be happy, right? So characteristics of work can affect a worker's physical and mental health, and we need to look at both the physical nature of the job, so sitting long hours at a computer is bad for you for heart attacks, but also psychological, just being tired at the end of the day. And more we need to look at social support for people living healthy lives. We also have seen a link of work-family conflict not only to cardiovascular disease risk, but depression, burnout, even accidents at work, let alone smoking, alcohol consumption, drug use, divorce, whether people even think they can start a family, purchase a house, exercise. And we also, one study from the Work-Family Health Network I'm going to tell you about in a minute, which was the largest study funded by the National Institutes of Health to look at work-family conflict as a pathway to help, a $30 million interdisciplinary study. Penn State University did some work that showed that on days that parents have stress, and they measured cortisol, so they had spit kits, you measured the children's stress that same day, and they had the same levels of stress. So we're bringing it home biologically to our families. So societal levels for reconciling work-life strains, I tried to put in some global perspectives, and then I'm going to move to my own research. There are kind of three ways societies have thought about how to solve work-life strains. One is that you emancipate caregivers from even needing to work outside the home when you have child care needs, for example. So you place an economic value on care work, you have paid leaves. Sweden and Norway are some leaders in that area. Another example would be to basically provide public supports that are really wonderful to allow people to work while caregiving. So we have really great public child care, for example, in after-school care in France or Germany, but then there are a lot of holidays and still women are still more involved in caring for child care. Flexibility is the third solution. If we could provide supports to encourage people to stay in the labor force. You have a right to request this flexible schedule law. I am hearing that there are some challenges in implementing it. Australia has such a law as well. Gradual return to work would be wonderful to have that be the norm. And I'm going to talk about there are gaps in even whether people get pensions if they're working part-time. And those types of laws are helpful to provide flexibility. So 3 different ways of dealing with this. All have drawbacks, and it would be nice if we could come up with ways to implement all of them at one time. I'll give you some statistics that might be shocking and also help you think about how we could maybe move this. And what's hard is we have child and family policy under certain parts of government, and then we've got economic and commerce in another part of government, and we can't seem to get parts to work together. But the maternal employment rates for children under 15, you'll see the US and the UK are relatively similar. About 66 to 67% of women work at least part-time. OECD average is 66.2. But then I'll show here, and on the next page, you've got Denmark at 84. That's a big difference. You've got the Netherlands, which has the highest percentage, I believe, of part-time work available. I once went to a conference there called 24 and More, and that was the average number of hours that women worked, and they're trying to make part-time work a norm. So you've got 78% participation. Now look at the cost of childcare. In the UK, 40%, almost 41% of average wages are going to childcare. The US, 38%. But then you look at Denmark and the Netherlands, that cost has gone down to 13 or 11%, probably because there's more flexibility and part-time work and families are taking some of the care. And then you also look at pre-primary spending, so after school care. Child care doesn't end when kids just go to school. School now ends in many countries at like 2:30, 3 in the afternoon. So you look at spending on that, and once again, Denmark, 1.3% is an outlier. UK is pretty good at 1.1. But now I would say even in high school with the media and social media, we need to have some kind of monitoring even for older children. Just to share the other part of the chart, and this is all up on OECD, other outliers are Finland, 77%, Iceland is tremendous, 84.8%, and Sweden. So if we solve one problem, such as let's get women working without adding to childcare support, flexibility, school programs, you're still going to have barriers in women's advancement. Paid maternity leave, I'm sad to say the US is still one of the 3 industrialized countries that doesn't have paid maternity leave. The extent of leave varies from 14 to 25 weeks to 52 or more. The blue countries are 52 or more. And the challenge is right now that without shared care, without giving longer leaves when both men and women take the care, it's still in some ways holding women back from advancing. So while maternity leaves aim to protect working women during their pregnancy and recovery from childbirth, parental leave, which is where we should move, refers to a relatively long-term leave available to either parent, allowing them to take care of an infant or young child over a period of time, usually following the maternity or paternity leave. So it's really for childcare, and I would like to see us have just family leave for elder care and one's own health care. More people have, bipolar, ADHD, cancer, whatever we have, we should allow that for any type of care. And while the US is very behind, the Family Medical Leave Act does allow people to even use it for all of those reasons, or even like, I studied one workplace for asthma. Somebody had to go give their kids asthma shots and they could get off work. Lastly, I wanted to mention that there is a link to child health from leave policies for care. And this is from a study that was reported from UCLA. And basically, in countries across the world, infant mortality is reduced by 13% when you have strong maternity leaves. And one reason for that is children are more likely to get vaccinated, just getting children to the doctor. So, Swedish men can have it all. They get in Sweden, you get 480 days per child for leave until the child is 8. And 60 days are shared care, specifically allocated to the father, and they get pay up to 80% of wages or a cap. The unintended consequence, even in Sweden, is women still take 75% of the leaves. Why is that? Men earn more. So when households are making the decision, you say, well, which partner makes more? They should stay working. So it's perpetuating long-term change, but still, I still look at Sweden as a model. Well, this quote here, as I wanted to share, is from, you won't believe what year, 1973. The clear fact is that keeping house and raising children is work that is, on average, as difficult to do well and as useful to the larger society as almost any paid job involving the production of goods or services. The difficulty is not that most people don't believe this or accept it. We pay lip service to it all the time, but that whatever our private and informal belief systems, we have not, as a society, acknowledged this fact in our public system of values and rewards, and most certainly in our private ones. When we think about care for others, we're much more supportive of care for our own families than care for other families. And if we look, though, in terms of parents in general, while work-family conflict is often framed as a female issue, it is a people issue. And evidence shows that when fathers start becoming more involved in caregiving, so this is a chart of parents and non-parents, and if you're a telecommuter or not, and using it for, in part for family reasons as much as for productivity, that men suffer just as much as women. And both can get as depressed or experience psychological and negative health effects as they get more involved in caregiving while trying to work. So we have to solve this in terms of flexible schedules. Studies will show that if an employer thinks that you're teleworking to work on that report all night, great, they love you. But if they think you're teleworking for family reasons, you get rated poor in your performance. So these are the types of questions that could be looked at more carefully to support both types of needs for flexibility. Let's look at extending the tenure clock. That's a popular problem that many women academics face, because you take 6 years maybe on average to get a PhD, then 6 or 7 years more to get tenure, and then you're probably almost 40, right? So what happens in many universities is they allow you to extend the tenure clock the year you have a child and get an extra year. So some people looked at economic professors, and they found that all professors had a 30% of tenure possibility before the leaves were put, policy, the extended leaves in place. But post-policy, they found that men had a 19% greater probability of getting tenure if they took the leave, and women had a 22% less probability of getting tenure when they took the leave. Why is this? Well, if you look at the picture there, there is the biological fact that women are dealing with caring for the baby in terms of nursing and recovery from the health, but men were more able to use the leave for writing and advancing. So we have to basically look at the unintended consequences of leaves and try and solve these social problems. I also want to turn now to the need for our solutions to try and integrate perspectives. So one of the challenges of figuring out why women aren't advancing is there are kind of 3 reasons why people think that women aren't getting ahead. One is the career preference view, the second is the discrimination view, and the third is the work-family view. So the career preference view says that women self-select into or opt out of certain occupations or jobs, creating gendered career paths. So women will choose a job in part because it fits their values, that maybe I'll be able to help people, social work, teaching, and nursing, for example, were common historical occupations, and maybe I'll be able to combine a family with this. So that would be one reason that women just don't lean in enough to the better occupations, or they cut out hours when family comes first. The discrimination perspective would say that explicit and implicit gender biases exclude women for opportunities. And so if women are trying to be a leader and they're very authoritarian or even just not helpful and agentic and say, how can I help you? That they're not going to be liked as leaders. So we need to change the culture to sort of help us understand our implicit biases. The third option, the work-family option, says that women are more likely not only to be more involved in family, but when you have families, it differentially affects women's strain and rewards compared to men. Well, what we've done in many organizations is we've tried to put in policies that focus on one perspective without dealing with the others. So for example, if we put in that extended tenure leave, that would be a work-family perspective, but then we didn't look at how its use was linked to career preferences, and it ended up having adverse impact in how it was used. If we do just focus on the discrimination perspective, so now you have quotas, for example, promoting women to corporate boards and say, let's get women on those boards, well then maybe you're going to get women appointed that don't have a lot of family care while they're being appointed, but they're more politically connected. So you haven't solved the gender problem just by putting a body in place that is a woman. If you look at career preference, and STEM's really hot right now, so let's have more role models and get rid of that culture that is not supportive. That's important, but we still at the same time need to have a way to look at, well, how do we get more men involved in caregiving or in healthcare? How do we make it an inclusive environment for everyone and promote lack of stereotyping for men and women as well? So I would like to see us try and look at multiple perspectives as we're moving organizations. And this was an article I just published this year called Opting Out or Pushed Out: Integrating Perspectives for Gender Inclusion. And if we promote these perspectives, some metrics we might look at for women's career equality would be whether women and men have equal access to and participation in career opportunities at every level of the organization, and whether they have equal work and non-work outcomes in terms of starting a family, number of kids, likelihood of being divorced, getting married, and as well as pay and promotions. And studies will show women that rise to the top tend to still have fewer children, or they have a stay-at-home partner. And so we're basically replicating some of the same regimes for women who advance that we had in traditional families. All right, so our rhetorics are kind of mixed in terms of how to deal with gender, whether to support work and life. What can we do about it? Well, let's look at workplace interventions. Can we change work and not just focus on workers? And I would argue that if you have organization surveys that you measure not only these job challenge and learning, my job lets me use my skills and abilities, my supervisor supports my work problems, I'm respected at work, I have a lot of autonomy on the job, I can make enough money and have economic security. I would like to see every organization have a measure of work-life fit. I have schedule flexibility to successfully manage work and family, or my schedule meets my needs, or my supervisor cares about the effect of my work on my family and personal life. This is a core job attribute. So in order to move this, we need to think about work-life issues as part of a three-legged organizational stool. So you see my little picture of a stool there. And the first leg is formal human resource policies and practices, including work, family, or life policies that allow you to have a flexible schedule or healthcare benefits and so forth. But really, we also have to look at then the job conditions and organization of work. And so those flexible, how schedules and staffing practices are implemented, whether jobs are designed where you have to work a 60-hour week or split shifts or weekends. And then thirdly, we have to, third leg after job conditions and formal HR policies is the culture of our occupation. So think about academic cultures. How do you get ahead in academia? You just do more. You get on more committees, get more awards, and that's important, but at some point, people are going to end up with burnout, and those that then do take more time for self or family are viewed as non-ideal workers. In one way, in terms of email response times, how many of you have ever sent an email and somebody's responded within like 30 seconds to your email? Well, is that really productivity? And basically for our students today, many of us, or if we're dealing with coworkers, that's one way we show people we care about you. And we have to really help organizations think about how we manage response times as not just a sign that we care about you, but I'll answer you within, by the end of the day. But we don't do that, so people are really burning out as well. We need to move now to think about work-life issues as a mainstream issue, and I feel that we have not viewed it as that in much of our human resource systems. We have implementation gaps in terms of poor cultural acceptance, so the career-oriented workers do not use work-life policies and do something that's called bias avoidance. So they don't, if they telework, they don't tell anybody that they're teleworking to also take their kid to the doctor or go to a medical appointment for their grandmother, but they sort of lie. And we need to have role models that show that this matters. So I'm going to talk about experimental intervention research. And one reason I think society is stalled is we haven't held work-life and stress research to the same rigor as other scientific experiments. And we do need those randomized control groups. And even though I enjoyed David Guest's panel very much where he talked about how interventions are challenging, one thing that we can do is basically have quasi-experimental studies. So perhaps you look at one borough where they have a great after-school program, or employers are bonding together to have elder and child care options, and then compare another borough where they're not offering that. That's an experiment right there. Or in a company, you could do a pilot and offer some of these interventions I'm going to talk about to different groups. And then later on, the control groups, you could offer the training to them as well. So you show the evidence of it. So work-life intervention are organizational change efforts aimed at reducing work-life and work-family conflicts in order to enhance the well-being and effectiveness of employees and their families and those who they work for a triple bottom line of employers, employees, and families and society. And I do think initiatives is a good word, but we have kind of fuzzy language about work-life policies. And I think we moved from calling them work-family policies to work-life so that singles would feel they could use it. And I don't believe that that is a wrong thing, but I also think we should say work-life and family and not hide the fact that people do have families, and studies will show that singles will answer surveys saying, I have a family, I have my mom, I have friends that I view as family. And we need to put it more front and center. So this is from basically the World Health Organization. And if you think about interventions, there are four areas that you can change. You can change people's personal health resources. You might train people to coaching or use exercise or individual level solutions. You can change the physical environment, maybe ergonomics, so have people standing up when they're working at their computers, for example, or in a factory, take breaks. You can change the enterprise or community involvement to try and have employers and communities bind together to have good commuting resources and services. Or you can change the psychosocial work environment, how people think about the workplace. And the interventions I've focused on have often focused on the psychosocial work environment. So there are three major studies I've been involved in recently. One is this National Work-Family Health Network funded by the National Institutes of Health. It had 7 major organizations from Harvard Med School to my university, partnering with an occupational health psychology program at Portland State, to sociologists that looked at the structure of work, to family scholars. We also had Kaiser Permanente, which is a major private healthcare organization. And these interventions through NIH, what we tried to do was in randomized control experiments, change nursing homes, cultures of IT workers, cultures in hotels, and just by training supervisors to be more family supportive, we saw some improvements in depression and well-being. We also looked at something called ROWE, results-oriented work, where we tried to remove barriers to just showing up at work for face time and had people have more control over their own schedule. The second intervention is work-life boundary management assessment, and you can think about here what your style is and how you self-regulate boundaries, and work teams can think about boundary management such as in telework or global teams and how to manage when people are on and off line. And then the third intervention is looking at cell phone use with hourly workers and policy change. So we all think about our own use as professionals with email. Many people that are working for Homeland Security or at airports or in restaurants are now being connected. And what does that mean for our quality and well-being? So this is the Work-Family Health Study, and it shows we crossed the whole country with universities. And I was talking to your dean. One of the interesting things about the way we structured interdisciplinary research here is we had collaborative funds where 25% of the grant could not be spent unless all of the centers agreed. And what that did is it promoted uses of different types of measures. So we had labor economists, and we would put those measures on for presenteeism and productivity, as well as traditional psychological measures or family measures. And so you do need some way for us to collaborate on these problems across organizations. From 2005 to 2008, we launched these 4 policies or studies and piloted in 4 industries, and we tried to identify what causes work-family conflict and what is modifiable by workplace interventions. And then in 2008 to 2013, we went into a high-end and low-end workforce, and we basically looked at whether we were able to reduce work-family conflict for IT workers using the same types of changes as we did in a nursing home, but we just tried to increase social support. So an IT worker, the social support might be you don't have to get up in the middle of the night to take a call, but for a nursing home worker, it might be if you can't come to work, we'll find somebody to cover your shift. I'd like you to think about your own family supportive behaviors. This is the intervention that we spent a lot of time on, and we found that supervisors didn't really know how to be family supportive, and we identified 4 behaviors. The first is emotional support for work and family. And this is the one thing that artificial intelligence can't do, empathy. So somebody tells you something, I can't come to work tomorrow, what do? Do you kind of grimace? Or do you say, why not? What's going on? So a sample item, think how you would answer this. My supervisor takes time to learn about employees' work-family needs. We have both workers and their managers fill this out. Instrumental support with scheduling conflicts. I can rely on my supervisor to help me with scheduling conflicts if I need it. So think about it, if a worker can't come in, is it just they figure it out themselves, or do you try and have systems where people can manage it? Role modeling. My supervisor is a good role model for work and non-work balance. Well, if you work for a workaholic, you're going to have problems as well. So we need to not hide why we're leaving work, but also make it okay for people to talk about personal needs. And then creative work-family management. In some ways, this is a transformational leadership type of measure. My supervisor is able to find ways to work with employees to meet both the needs of associates and the business. Win-win. We train managers in this online training, or we had iPads. We'd even go into like bakery and the grocery stores, and somebody could take the training and stop while they were putting cookies in the oven. And then after we trained them, we had people self-monitor and set goals for 2 weeks. Now today we use an app and we email people, have you set a goal today and how many of these behaviors you've done for each worker? But in some industries they like just a card and make ticky marks. And we found pre and post in these randomized stores, 12 stores, it didn't matter if your supervisor was trained or not. If you were in a store where leaders were trained, so this was preventing work-family conflict in the organization of work, you reported lower depression and lower physical pain and lower work-family conflict. So if you were in the group with need, it did improve your well-being and health. So we're now doing additional studies on this. So the 3 things we learned from our studies, and we've continued this, is if people perceive they have schedule control, if they perceive that they have supervisor support for work and life issues, and if they feel they have a culture that supports focusing on results and not just bureaucracy, but let's focus on what matters most in our business, that they are people that have lower work-life conflict. So any intervention that you think about, you should be thinking about giving people some control over when and where and how they work, try and increase leader support of personal life, and try and look at things in the culture rather than saying, macho, I worked all night, isn't that great? Try and think about rewarding balanced type of cultures. The second study was on work-life boundary management, and that deals with technology. And so I have a psychological assessment that you can take for free at Purdue, but it's also sold by the Center for Creative Leadership. And people take an assessment and learn about how do they manage interruptions. So you're at work and you get a text from your partner or even from the local grocery store or Marks and Spencer's. Do you look at that or do you ignore it? And same when you're at home, do you check work texts and emails? We also measured people's work and family identities, and the old research used to assume, or the traditional research, if you were high in work or career orientation, you couldn't be possibly highly identified with family and personal life. Well, many of us today are dual-centric. We're high in both. And boundary control, whether you feel you have control over boundaries, some people who are single parents or a tough job, it's how their job is designed or their family's designed. It's not something they can control. So one of the innovations I did was I took that out of the measure to what you do to how your job designs, so separating how you manage interruptions. So let's see which you might be. What I found in the research is that some of us are integrators, so these are people that all day long are having personal role engagement from emails and texts and work engagement going back and forth all the time, these interruptions. Separators work in chunks. So they might, even at lunch at an organization, they might not take any personal texts or emails till lunchtime or do all their personal calls for setting up a doctor appointment at lunchtime. Or at home, they shut down their laptop if you're on Friday night and they don't look again till the next Monday. Work firsters are those that are asymmetrical separators. So what they do is they manage their whole life to basically support that primary role. They might be called workaholics, but I won't say that. But these are the people where work is always interfering with personal life. So it's Christmas Eve and you're buying your Christmas presents, but you don't have personal interruptions coming back into work. Similarly, family or personal life firsters, they always have family and personal needs interrupting work. And they never really have the reverse, so maybe you don't get advanced in your career because you're always putting your personal needs ahead of work. Cyclers, and academics are a lot of cyclers. These are people that have both types of styles throughout the year. So think of the startup of the term, finals, grading. We go through lots of cycles. Doctors have this, and maybe peak seasons for flu. And so cyclers risk burnout because you you can't deal with the highs and the lows. Or think about accountants during tax season and how it's busy, busy, busy until the taxes are done for that year, and then there's not enough work in the summer. So what I do in the training is I have people take the assessment, teams can take the assessment, and then think about tips to help different types. So for separators, people have to be upfront and say, I'm not going to answer email on the weekend, but that doesn't mean I'm not a good worker. I'm just not going to be available because I'm on vacation. But if it's really important, here's a way to get a hold of me. You need to be a little bit more flexible because separators get really annoyed when their schedule gets out of whack and they're not as flexible. And what I found for some research says that if you're at home and you really have trouble concentrating, you should have a set door to close in your office. And don't try and work at the kitchen table, but work in your workspace at home. These same people have separation by having separate Twitters, emails, even separate cell phones, and they turn off the cell phone on weekends and or don't sleep with it in their bedroom. Integrators need help with time triggers and knowing when to switch from work to family. So how many of you have ever been late, like picking up a child or meeting a partner at a restaurant because you couldn't leave work? You are the people that need to have a little ding go off on your phone to say, transition 15 minutes from now, get ready for the next activity. We're kind of like the kids that play too long in the sandbox and can't move on from recess. We also need to schedule time buffers and make sure we don't overschedule. And part of that's, we often forget the rule of 3, that things take 3 times longer than we think. And the idea of switching costs, process losses from switching back and forth from an email or another task to another. We all know we shouldn't text and drive. Why do we think we should be constantly looking or thinking about personal texts or emails while we're trying to get that paper done? So we need rituals and routines and a little more structure and self-regulation, and maybe using some of those separator strategies. So I have people have tips. I've had managers take this assessment and then work teams take the assessment. And I have groups talk about stories about times where it was really difficult and to work with somebody who had a different style. And those stories help people learn. The last study that I've done that's really quite interesting is with cell phones. And I've been looking at grocery store workers that are using cell phones on the job in 70 stores in a randomized control experiment. And what we're finding is, even though the store doesn't pay for cell phones, that there are some benefits to using it in a way that can help workers. So we teach supervisors now the cell phone policy we're putting in some stores, that we tell supervisors that if workers see you using a cell phone on the floor in front of customers for personal reasons, workers might think they can too. So we train supervisors on this idea of role modeling. We also train associates to not start when they go to their break to be using it on the floor and to keep it silent. But what's cool about this company is they let people keep their cell phones on them on the floor. They don't make them lock them up like Walmart does. And so this allows people to get vibrate if like they want to know their kid gets off the bus. And we have trained the company that if somebody needs an important text or needs to take a call from the doctor, they can be on a cash register and say, hey, I need replacement. I need to take this cell phone right now, this call, even if it's not my break. So it's both good and bad to be clear about when it's okay and not okay to use it. We also came up with some training on non-work interruptions. So we found in our pilot study that people would be calling up managers on like their vacation and say, you know, where is this ingredient in the deli? Or this machine's broken. And we trained associates that, except for emergencies, they shouldn't contact the leader. We train leaders to not contact associates the same way. And we tried to basically make it clear what's an emergency or not. So here's some training we developed. An associate told you that she's waiting for a call from the doctor because her child is sick. What should you do? Tell the associate she can step off the store floor and answer the phone. Tell her she cannot take a personal call on the clock. Tell her that she can answer that call right away without stepping off the store floor because it's very important. Of course, the correct answer is, you know, we can take it there, but we step just away from the floor and have somebody cover it. And we try and train the leaders that it's important when people have important personal things happening that they can take those calls right away. Calling the store director at home. Many of the supervisors that we're studying are hourly workers. They're one above a team leader, and they're working 6 days a week, and they're burning out. So here's an example. Mark, a store director, gets phone calls from the store when he's off work, sometimes for the right reasons, but other times things that could have waited till he's at work. Which instance is not one of the right reasons to contact the store director at home? The electricity at the store went out is one option. The store ran out of Cheerios. That's another option. A customer got caught stealing, which happens all the time in retail. An employee was injured at the store. The correct answer is obviously, we probably shouldn't have bothered Mark about Cheerios. But the others, yes, of course. So the company was kind of afraid of us teaching them not to contact leaders at home. I'd like you to think about these different levels then for interventions that you might be interested in. So here we think about the family realm and how we could affect children. So maybe you could come up with a policy between the employee and the family level to allow people to not miss school appointments or take family to doctors and not put it off, doctor's appointments. At the employee level, and the supervisor level, we might do that family supportive supervisor training or teach about emails and cell phones as well. And then at team level, you might come up with norms and how we might manage these same issues. Different work sites, a rural borough might have a different approach to managing work life than people that have a really long commute in London. So maybe we need to think about commuting days and having a way that people might shorten commutes at the organizational level or community level. And then in terms of intervention design strategies, one of the things that I would like us to start thinking about is ahead of time saying what needs to change in the structure of work to reduce work-family conflicts. I've told you 3 things: control over schedules and work time, increasing social support for personal life, and let's reduce face time and unproductive work processes, also known as sludge. Second is we need to customize our interventions, so the same interventions for a IT worker might not be the same thing for a 24/7 factory worker, but we can have things like shift trades or a no guilt 800 number I've studied, where you can say, I can't come to work today, and you have an extra staffing person that rotates different jobs, but we tend not to share personnel across areas. So I do think staffing policies need to be looked at. We might look then at how to not just hit one of those levels that I just talked about, but maybe what I've found is if you hit 2 levels, so you hit the employee and the supervisor, you hit the team and the organization, that's much more effective than just trying to change, okay, you individually manage your separator or integrator style more effectively. We're in a context, so if you're the only one not answering emails on the weekends, you might be stigmatized, but if both do it, both levels are changed, it might be successful. And move to more stakeholder involvement and not just top-down approaches, but participative approaches that are interdisciplinary. The last theme I want to talk to before taking questions is this idea of work-life flexibility being a growing form of job inequality. And when you talk to leaders for Society for Human Resource Management, or you have chartered personnel managers or leaders here in the UK, workplace flexibility is still cited as the key way to attract and retain talent. It comes in above trust and leadership or even meaningful work, 58% of respondents, and these were C-suite leaders. Yet the problem is we haven't really given equal access to different work groups for some form of flexibility. So all I'm saying is that every type of job can have some way to allow work and personal life to be more controlled to fit personal needs. And so we can look at things like, what are the variability of your hours? What's your workload? Are you able to take a leave? And so forth. And work-life inequality is the degree to which individuals in different occupational groups have unequal access and ability to use flexibility and different outcomes from different forms of flexibility. And so we need to really come up with different options. So what we found in our research, and this paper has just come out in Academy Management Annals, that occupational status is really an important predictor of whether you can even use work-life policies. And for example, boundary control, so not having to answer emails on weekends, or schedule control, those are things that some lower level workers need most. So I studied an oil company that called people in to work on the at the oil processing plant, and if you didn't answer if you answered your supervisor's phone when they were calling you in for a shift because somebody didn't show up, and then you didn't show up, you would get punished in terms of absenteeism. So even hourly workers or people that are in blue-collar jobs, sometimes they need to not have to be called in because somebody didn't show up. So we need to provide more control over availability for work and scheduling. And yet, for upper middle level people, we can take emails and we can telework sometimes, but our biggest problem is separation from technology. So we need different types of interventions for different worker levels. And what happens though is in many companies we have not what's called balanced flexibility that's win-win for different types of workers in management, but we have unintended consequences where people feel that I have to work all the time for the employer, or you have the other a downside of people taking too much flexibility, one worker in a team, they're not called out on it, and it increases the stress of other workers that are using flexibility in a way that doesn't hurt coworkers. Last thing I'd like you to think about is to also look about some employment laws. I know people's eyes glaze over, but if occupational psychologists don't start looking at the policies that affect the workplace, we're not going to have change. So I'll give you a couple examples from the US, and you can think about here as well some issues that might be relevant. So the Pregnancy Discrimination Act doesn't protect discrimination against working parents. It only protects discrimination against women right after the birth of a child, and so not these child care issues later on, and doesn't allow for flexible scheduling. There's also legal barriers to use, and it's poorly enforced. The Family Medical Leave Act I've talked about, and basically many low-level workers or many even middle-level economic workers can't afford to take unpaid leave. And then we also find people at the top can be excluded from using it, the top 10% of a company. And employers a lot of discretion in how they define calendar year. The Fair Labor Standards Act governs overtime, and it doesn't cover the right to refuse overtime. And there's no mandates in the US for paid sick days, paid vacations, paid holidays, and employers get to define what is full-time and who gets access to benefits and pensions as well, which leads us to ERISA, the Employee Income Retirement Act. And in the US, it's not required that you offer a pension to your workers, but if you offer one, you have to follow ERISA rules. But there's a 1,000-hour limit. And so if you work less than 1,000 hours in a year, you don't have any of those hours count toward your pension. And so only 21% of part-timers are covered. So you could be working part-time for years and might not be counting those hours toward a pension. And if you change jobs, which many part-timers do, or people in the gig economy, it's not portable. But California is a bright spot. They have just passed at the state level benefits to people who need to take time off to work for a seriously ill parent or child or grandchild, which I think is cool, sibling, registered domestic partner, and they're also available to new parents to bond with their children or kids in foster care. 18 million workers are covered. It's funded through mandatory payroll deductions. Employees get up to 55% of their weekly earnings, but they have to have worked a minimum amount of time to qualify. So in closing, the trends that I see for the future is that artificial intelligence, I would love to see some studies in that area, thinking about how to use it for data analysis patterns on what works and doesn't work for work life, the use of apps to help us remind for self-monitoring. The downside of artificial intelligence and the technology and the discontinuities is we're having rising job displacement for the least skilled, and unless we use this to allow people to renew their skills, we're going to have growing work-life inequality. And this could occur on a global scale. So I've studied some of the studies that have been done look at people in developing countries and developed countries. And you know how you can say, I have a project and will you sign up and do this 10-minute project for me and I'll pay you? Well, what's happening is people in the poorer countries are doing that for the developing countries. So you have economic inequality across global borders and not just occupations as well. We have done very little to deal with the elder care crisis. So some of the same, and we haven't solved child care yet. So some of the same issues for child care, we need to put elder care in that equation of our public policy and company policies immediately, or we're going to have horrible shortfalls of labor market. And we need to also look at interventions for challenging occupations. Everybody wants entrepreneurs in their cities. We need child care and elder care and work-life care and exercising to help to have healthy startups, healthy entrepreneurs. Because the hardest thing about being an entrepreneur is if you don't work, you don't get paid. So I don't see that as a pathway to work-life well-being. Same for STEM and the technology. A lot of the studies show that in the Silicon Valley there are lots of work-life perks to freeze your eggs so you can have a baby when you're not working crazy hour weeks, or they have laser tag or lots of perks to exercise or stay at work, but not so much for time with family. And we really just need to, some of these interdisciplinary teams, I encourage you to work with somebody outside your discipline or area to look at solutions to these problems, combining multiple perspectives and levels. So it's a quick whirlwind, and it's time for questions. Sure, back of the room.
I just wanted to put some things into perspective based on your whole presentation. We live in a time of great cynicism and negativity, particularly here in the UK with all of this stuff with Brexit and what's happening with the government and all the recent events. I've been working a long time in the private sector and now working in the public sector. And there's a lot of good things actually happening that we don't hear about. I was recently at a public sector show a couple of days ago, and many senior civil servants from central government were there, talking about many changes happening to the UK economy, which are very positive. They're moving the UK to the digital economy, which is creating a lot of career opportunities for young people in ways that have never been seen before. New ways of innovation and working, partnering with various organizations, which affects HR policies, talking about work-life balance. A lot of the things that you've addressed are actually being studied very seriously now by the government, but we don't read about this and we don't hear about it. So I just wanted to throw that out to let you know that it's not all bad news.
Well, that's great to hear, and I do think that there is a lot of innovation happening. One of the things I've learned is I've gotten actually a small business technology transfer grant for that family supportive supervisor behavior from the National Institute of Aging. Is as you go into companies, because you say, you know, would you like to do this? What organizations want is data or examples from their industry context. So one of the challenges I see is for private sector to say, oh, this works in government, this is going to work in my industry, or somebody in banking to say, well, this worked in healthcare, this will work in banking. So maybe just getting the word out will be helpful, and trying to replicate in different contexts. That's great to hear. Another question or comment? Yes, go ahead, back of the room.
I saw the figures between how much childcare costs and your concerns about a falling young layer of young workers. Is it just in the countries which have very high costs, or actually is that globally? Is the cost of childcare depressing the amount of children that people have?
I mean, I'm not an economist, but I think if you look at that, and you also look at the next page on leaves and shared care, they're somewhat connected. And the age at which people are marrying, starting a family, is increasing. Childhood is lasting longer, you know, into our 20s and beyond.
Or 30s.
Any, one more question or comment? Well, I hope you'll go back to your organizations and say work life is not a nicety, it is a necessity, or we will be in big social and economic problems, and there's a lot of positives from doing that.